Hi, I'm Rudy, and I'll be talking about sexual variations. And before I start this presentation, I want to give out a little warning because this presentation contains content that may not be appropriate for all ages. So some of us like to keep our sex life fun and exciting, and with the internet giving us ideas and movies like 50 Shades of Grey feeding into our curiosity, it's easy to, go out and look for different ways to express your sexuality. So in this presentation, I will be talking about variations in sexual behavior, what paraphilias are, some examples of paraphilias describing the differences between victimizing and non-victimizing behaviors, and lastly, how to stay safe. So first, what is sexual variation? So this term is used to refer to behaviors that are not mainstream. Mainstream behaviors include intercourse, oral genital sex, masturbation, and desires based off of one's sexual orientation. And anything else that isn't mainstream is considered atypical or kinky. Now, but when is it a problem? So the American Psychiatric Association has classified severe sexual behaviors as a paraphilia. But what is a paraphilia? So the Diagnostic and Statistical Manual of Mental Disorders says a paraphilia is a mental disorder if it involves non-human objects, or if it involves suffering or humiliation of oneself or one's partner, or if it involves children or another non-consenting person. And there's some debate of what really is a paraphilia and if the Manual of Mental Disorders really classifies a paraphilia as a true paraphilia. There are two categories of paraphilia, non-coercive and coercive. The non-coercive is considered harmless because it's non-victimizing. And examples of this is fetishism, and fetishism is just using an inanimate object in your sex. For example, this guy's using this shoe or foot. Another example is transvestism, and this is cross-dressing, usually males, in clothing of the opposite sex. Now the other type is coercive, and this is the paraphilias that involve victimization. Some of these include zoophilia. Zoophilia is having sexual activity with a non-human, like animals. It's also known as bestiality. Then there's voyeurism, which is observing an unexpected person who is engaging in intimate behavior such as disrobing or having sex, just like this peeping Tom. Then there is exhibitionism, which is exposing one's genitals, buttocks, or breasts in public to another person or group. And then there's telephone scatologia, and that's making sexual and obscene phone calls. We also have Freuderism. Freuderism is touching or rubbing of one's genitals or pelvis against a non-consenting person in public spaces. So if you see this guy, just go the opposite direction. Then there's necrophilia. Necrophilia is having sexual activity with the dead bodies. Then we also have pedophilia, and pedophilia is having primary or exclusive sexual behavior with a prepubescent child. And then there's sexual sadism and sexual masochism. Now, how to stay safe. If you're into S&M, you want to keep in good contact with your primary healthcare provider because there's always, bruises that may come from it, or your mental health could be affected by this. Another good thing to do is to educate yourself. When you know stuff about these different sexual variations, then you're going to be better prepared to handle situations that where you may not feel safe. Here are my references, and thank you.